for North Coast.
Honourable Speaker, no one on this side of the House is negating the professionalism of the frontline health workers in this province. We are challenging the professionalism of that minister to address these problems. Mary Louise Murphy went to Abbotsford Regional Hospital on January 30th complaining of pain. She was given an injection and sent away. Within a day, she had died. With doctors sounding the alarm about the hospital being dangerously overcrowded, patients are left without confidence that their hospital can handle these emergencies. Honourable Speaker, why isn't the Health Minister fixing the congestion problems at Abbotsford Hospital so patients have a health system they can put their trust in?
Minister of Health.
Thank you, Honourable Speaker. Well, again, Honourable Speaker, I want to make it clear that the physician the members are quoting has been very clear not to link any deaths to the fact that they are very busy at Abbotsford Regional Hospital and at other hospitals around the province at this time of year. That's no different today than it was 10 years ago, 20 years ago, 30 years ago. Winter is a busy season, Honourable Speaker. That's the reality. And that's why the physicians, the nurses, the other healthcare professionals in our hospitals do an amazing job. And in the case of Fraser, Honourable Speaker, they are taking a number of measures to try to ensure that we don't rely so much on the acute care system, opening up 400 new residential care spaces, using new tools to divert people from the emergency room when it's not appropriate for them to be there. Honourable Speaker, Fraser Health, all of our health authorities are very focused on strategies to decongest emergency departments at a very busy time of the year and provide high-quality health care to British Columbians.
And for North Coast on a supplemental.
Honourable Speaker, we raised this issue last year, and things have not gotten better, they've gotten worse. The health authorities' own numbers document the severe, unrelenting congestion at this major regional centre and confirm the alarms being raised by frontline physicians about the hospital's ability to fulfill its mandate, to deliver safe care to save lives. In September of 2014, 66% of patients waited more than 10 hours in Abbotsford's ER for admission to hospital. Fast forward 2 years, that percentage is 70%. To the Health Minister, why has this government let congestion get worse at one of BC's critical regional hospitals?
Minister of Health.
Thank you, Honourable Speaker. Well, again, Honourable Speaker, the Canadian Institute for Healthcare Information, their data will show that 90% of patients at Abbotsford Regional Hospital are seen by a physician in less than 2.5 hours, lower than the BC average, lower than the Canadian average, which is over 3 hours, Honourable Speaker. There is a seasonal fluctuation. The member knows that. But Fraser Health does a number of different things to try to make sure that the congestion of the emergency room is alleviated. In fact, a short-stay diagnostic and treatment bed process in the ED at Abbotsford Regional was piloted there on the suggestion of the emergency physicians, and that has.
Members.
Honourable Speaker, that has sped up the process at Abbotsford Regional. There's also a task group, including physicians working on other strategies, monitoring daily discharges, targets they strive to meet to ensure patients have access to diagnostic tests when discharged. And, Honourable Speaker, they're working hard, as all health authorities are, to ensure that patients are cared for at this very busy time of year.